What is health? Not what your doctor tells you, not the number on a chart, not the absence of a cough or fever. I ask you to think deeper. If disease is the shadow, health is the light, but light is not defined by the absence of shadow. It exists on its own. We live in a time when we can measure almost everything. Our steps, our heartbeats, our calories. And yet, we may not truly understand what it means to be well. So tonight, I want to challenge that idea. Health is not what happens to you when you avoid getting sick. Health is what allows you to live, to create, to serve, to think clearly, to love deeply. That is the question before us, not are we sick, but are we truly alive? Let's begin. Health is not simply the absence of disease. Too often we ask, am I sick? And we answer, no, and assume we are healthy. But that is a shallow measurement, a negative definition, not sick. Real health is far richer. Real health means your body is functioning with ease, your mind is clear, your spirit is engaged, your community supports you, and you support it in return. It means that you can respond to stress, recover from challenge, endure change, adapt. It means that when life demands something of you, you are not just hanging on, but you are moving forward with purpose. That is health. When I look back on the task of tackling the dreaded illness of polio, I saw children who survived, but didn't thrive. Their bodies no longer collapsed from the virus, yet their lives were still shaped by limitations. That taught me that preventing disease is only half the story. The story we must tell is one of thriving. When someone is healthy, they are not simply not disabled. They are alive in all senses of the word. They are engaged in life. They are free to act. They are free to serve. So let us hold this definition of health vitality, adaptability, alignment, and let us hold it not as a luxury, but as a responsibility. Because when one person is just okay, society bears the cost. When countless people are just okay, the potential of a community is diminished. When we accept not sick as our only goal, we settle for mediocrity. But when we demand true health, then we raise the bar for what life can be. We demand that our systems, our environment, our relationships support that higher state. Because health is not only individual, it is collective. We must also see health as a prerequisite for purpose. A person who is unwell may devote all their energy to managing symptoms, surviving from one day to the next. But a person who is well can allocate energy to creating, to serving, to sharing. Health becomes the foundation on which meaning is built. And if we accept that, then we accept that investing in health is investing in possibility. Investing in health is investing in innovation. In service, in community, it is investing in our shared future. Let me be emphatic. Defining health narrowly damages us. Defining health broadly empowers us. It holds us accountable to our bodies, our minds, our communities. It challenges us to ask, am I merely free from disease, or am I fully alive? It asks, is my environment helping me to be well? Are the people around me helping me? Am I helping them? Because health doesn't happen in isolation. It arises when biology, behavior, society, and environment converge in alignment. In the end, health is not an endpoint. It is a dynamic journey. It is a way of life. It is an orientation. If we embrace that, then the disease-free state becomes only the starting line, not the finish line. And from that starting line we run toward growth, toward contribution, toward enduring well-being. That is what real health is. When I speak of health as a collective responsibility, I mean more than a polite sentiment. I mean it in concrete terms. Your well-being is inextricably linked to that of others, and the systems we build matter. We often think of health as a solo endeavor, me, my body, my choices. But the reality is far broader. Our air, our water, our food, our neighbors, our institutions, these are not peripheral. They are the arena in which health lives or dies. If your body is well, but your community is broken, you carry a burden. If your environment is healthy, but your body is frail, you have a limit. True health requires both. Think of the epidemics we have faced. I spent much of my life confronting one of the greatest scourges of childhood, and I saw that vaccinating one child did not simply protect that child. It rippled outward. In that sense, one person's health becomes everyone's concern. If one child in a classroom remains vulnerable, the threat remains. If one neighborhood lacks clean water, multiple bodies suffer. It is not enough to patch individual gaps. The net must hold for all. This is a strong statement, not a moralization, but a fact. Civilization depends on the weakest link in our communal chain, not only the strongest. Moreover, health cannot flourish where inequality, neglect, or indifference prevail. If one segment of society is resource-starved and another abundant, the disparity undermines the whole. Science may cure a disease in one person, but if the next child lacks access, the epidemic lives on. Responsibility is shared. The scientists, the clinicians, the policy makers, the neighbors, each have a role. When we accept that role, we advance not just individual health, but public health. And in doing so, we safeguard the potential of society itself. Let me emphasize the environment matters. The institutions we build, hospitals, schools, public sanitation, are physical expressions of our commitment to communal health. A single well-equipped clinic matters. 1,000 broken clinics matter more, because the pattern, the system, the expectation is there. If we allow systematic neglect, if we accept that some are healthy enough and others forgotten, we concede that health is a private commodity rather than a public good. When we insist that every person has the right to the conditions that make health possible, we transform it into a shared foundation for progress. We also must recognize that individual behavior alone is insufficient. It is important, but it is not everything. You may choose wisely, you may care for your body, but if your water is polluted, your air is noxious, your neighbors neglected, your community disinvested, your health is still at risk. So responsibility flows in two directions, from you and from us. Public, collective, structural. That interplay is the essence of this keynote. Finally, when health is treated as a collective responsibility, something changes. It becomes a shared mission. We stop thinking of health as a luxury for some and a burden for others. We begin to see it as a right for all. And the implications are profound. Investing in public health means investing in our shared future. Because when communities are healthy, innovation happens, children thrive, workers are productive, societies flourish. The cost is real, but so is the return. And the return belongs to everyone. When I say that health is a foundation for purpose, I mean it in the simplest possible terms. Health is the soil from which human action grows. Without it, our ambitions shrink, our capacities retreat, and our highest intentions falter. If you are unwell, you may survive, but you cannot fully serve, build, create, or give. Health enables you not merely to exist, but to contribute. This is not a luxury. It is the essential underpinning of meaningful life. Consider what happens when you are physically sound, mentally alert, and tied to a community that functions around you. You possess not only resources, but freedom. Freedom of movement, freedom of thought, freedom of will. You are less weighed by the burden of your own limitations and more available to the challenge that life presents. In that state you can ask, what might I give? What might I build? What might I heal? Health is not the end point. It is the enabler. It is what lets us step from potential into action. Many people imagine that health is a passive condition. We are healthy or we are not. But I argue it is active. It is the fertile ground from which we emerge. When our organs work, our mind engages, our relationships support us, our environment sustains us, then we are ready for purpose. If any one of those elements is weak, purpose is compromised. The body may falter, the mind may darken, the spirit may shrink. Purpose without health is brittle. Health without purpose is wasted opportunity. In my years of research, I witnessed children freed from the threat of paralysis, freed physically, but still constrained in what they could become because the other supports were not present. The vaccine removed one limitation, but the presence of several other limitations in body, mind, environment remained. That taught me this truth: removing disease is necessary, but not sufficient. The next step is enabling life well lived, and that means health becomes a launchpad for engagement, for service, for contribution. In practical terms, we must design our systems so that health allows human beings to reach their purpose. Education, employment, environment, community, each must assume a healthy human being ready to act. If these systems treat health as an afterthought, then we betray that foundation. We must be intentional. When we invest in health, not simply as prevention of illness, but as enabling capacity, we invest in purpose, in meaning, in productivity. That investment returns not only to the individual, but to society at large. This also places responsibility on each of us. Do we treat our bodies, our minds, our communities as instruments of contribution, or simply as shelters from frailty? Health cannot be passive. When you awaken each day, you might ask, how does my health serve my purpose today? How does what I do build on my well-being so that I act in the world rather than withdraw from it? Because the truth is this: a healthy person may choose purpose. An unhealthy person is too often forced to choose survival. That difference is the one between living and thriving. So when we speak of health, let us not stop at no disease. Let us ask, what can this person do? What might this community become? What might we build together? What might we serve? Health becomes the path to purpose, and purpose is the proper destination. Because in the end, the measure is not simply whether you are healthy, but whether through your health you are helping, creating, caring, building, giving. That is why health matters. And that is why we must think of it as foundation, not finish line. So, when someone asks you, are you healthy? Don't just think of your body. Think of your mind, your relationships, the air you breathe, the life you lead. because health is not an individual achievement. It is a shared inheritance. It is what allows us to give, to grow, to become more than what we were yesterday. And if you understand that, if you carry that definition forward, then every choice you make, every kindness you extend, every problem you solve becomes part of humanity's healing. Health, after all, is not a destination, it's a direction, and the direction is forward. So ask yourself, not just once, but every day, am I merely alive? Or am I truly well? That answer is where your purpose begins.